So, welcome to Universal Digital Health, where we explore the intersection of technology and healthcare. In today's episode, we embark a crucial journey developing in the future of healthcare in low and middle income countries in context of the digital health opportunities and the challenges. So, today I am thrilled to introduce our guest, a distinguished healthcare expert with a wealth of experience working in low and middle income countries. I would like to welcome Dr. Hasan Nawaz, who is a medical doctor with a fellowship in public health and master's in artificial intelligence. Today, he will guide us through the current state of the healthcare in these regions. Thank you, Dr. Hassan, for joining us.
Thank you,
To,
Hamas.
to set the stage, I would like listeners to know about the overview of the current healthcare landscape in the low and middle income countries. Here you go, sir.
Thank you. So, just to give an idea on how is the health system structured. So, we need to first understand how it is structured. So, an health system is structured in like 6 building blocks according to WHO. One is leadership and governance, other is healthcare finance, other is health information systems, another is human resource, another is health service delivery. So if we look at the overall health system within the low middle income countries, we see that there are numerous digital health initiatives that are happening in all of these separate building blocks. So, with that being said, so I have already discussed we have 6 building blocks. So within each building blocks, within the low middle income countries, we see that there is the rise in the use of digital technology. I'll give you an example. Within health service delivery, we see this rise in telemedicine platforms, not just by the government, but by the private sector in these low income countries. And be it India, Pakistan, Sri Lanka, Bangladesh, South Asia, or Africa, even in the African region, apart from this telemedicine revolution, we also see this revolution of integrated EMRs, electronic medical record systems. What they are doing is basically they are digitizing the healthcare records, and in turn, this is paving the way for introduction of artificial intelligence within the health system. That's something around service delivery. When it comes to human resource, biometric verification is now everywhere, face recognition is now everywhere. What we are seeing within human resource development, almost all the trainings in medical colleges, postgraduate trainings, all of them have an online component to it. All of them are going towards blended learning. All of them are going towards asynchronous learning. And this is all digital technology that is paving the way for improving the capacity of the human resource. If you look at healthcare finance, within healthcare finance, we see the rise of fintechs, financial tech startups. And what they have done is that they have introduced these pre-payment mechanisms. A lot of these countries now have something called as BNPL, buy now, pay later startups, which basically what they do is that they allow these smart loans or these soft loans or these low cost loans that can be used, micro loans that can be used for health service delivery. In this way, a lot of people who are unable to access healthcare can do so. And at the same time, telemedicine itself is cheaper compared to other alternatives, which is conventional healthcare. So you can get a doctor sitting in an urban area, a specialist of urban area, to treat a patient in a rural area without the cost of transferring that doctor from the urban area to the rural area. That's the benefit of telemedicine. If we look at, apart from health finance, human resource, apart from service delivery, if we just look at health management information systems, HMIS, we see that there has been a rise in electronic health records, electronic medical records. The difference is that electronic health records are focused on healthcare as a whole. So they might use variable technology as well. They might use tracking system for healthy individuals as well. EMRs are focused primarily on the record keeping of hospitals. So primarily people who come with disease or symptoms of a disease, and then they are treated in the hospital. And now what we are seeing is that these electronic medical records and electronic health records are now becoming universal. An example of that is in India, they have done something called as Ayushman Bharat, which is basically a digitization. What they have done is that they have connected the national identification number of the individual and made it into the MR number, the medical record number of the individual. Now,
Mm.
what that has done is
Yes.
that has revolutionized the data keeping. And then eventually, when all of this data is combined in these data warehouses, we can very easily apply AI on this. We can very easily automate the diagnosis and also the treatment of a lot of diseases. And even if 25% of India is digitized in this manner, that would result in somewhere around 300 million or 400 million people
Mm.
giving their data record. And that itself could be revolutionary for anyone applying AI. Now,
All.
apart from that, within leadership and governance, we see a rise in digital technology. How we see the rise of dashboards. Every health manager, every health ministry is now applying data metrics, key performance indicators into various aspects of the health system, from human resource to service delivery to procurement to supply chain, everything. What that has done is that has made a lot of transparency has been brought into the system, and also a lot of accountability has been brought into the system using these digital tools. I'll give you an example that in a country like Pakistan, in a province, there was this flooding, and the aid that came, which was the nutritional aid that came for the population, it was basically taken over by the local politician and the local
Okay.
bureaucrat, and it never went to the people. But the thing is that the funding agency that was providing all of that, they had put these RFIDs, which are radio frequency imaging diodes, within all of these canisters of oil, canisters of food, and they were easily able to track that all the
Okay.
supply went just into one warehouse and never left it. So then they showed that data on a dashboard to the local politician, and then it was sooner or later disbursed. So that's the power of technology. It gives a lot of accountability. So spillage and corruption is stopped. Just giving you an example, and this can happen to any
All.
country. Not trying to name any country here.
So,
So a lot of accountability and transparency comes with digital technology. And so apart from this, the other building block is essential medical supplies. Within medical supplies, we see this rise of lean and agile supply chains. We see the rise of something called as LMIS system, Logistic Management Information Systems. Whether it is for vaccines, so we call it Vaccine Logistic Management Information Systems. Whether it is for drugs, so drug or pharmaceutical logistic management system. Hospitals apply this, and what they do is that they have a dashboard that basically showcases what is the inventory like, and how what supply is about to end, so the company can directly fill that supply. And because all of this is digitized, so we know that what drug went to which hospital and how much of it was used. It also gives you an idea that which hospitals have higher demand. It also gives you an idea of it reduces the chances of expiration of drugs. So just to give you a broad insight into, and this is happening in low middle income countries. I'm not talking about high income countries here. And if this is just a brief idea on how digitization is revolutionizing all the building blocks of health system. So if WHO says focus on the building blocks, just giving you an idea. Okay.
So this was quite fascinating and quite informative. Like it has given me all the knowledges that I wasn't aware of. So can out of all the domains you have discussed so far, like from telemedicine, EMR, or telehealth and health records, whatever, could you provide an overview of the ongoing digital health initiative that you find particularly promising in low and middle income countries? Like any particular domain you feel that that can make a major impact on these countries.
Absolutely. So in my opinion, and based on the data also that I've seen for the past few years, a lot of focus has been on service delivery. So people are focused on telemedicine or focusing on provision of healthcare in one way or another. Just giving you an example, there is a startup in South Africa. What it does is it provides pharmaceuticals directly from the pharmaceutical company to far-flung areas using drone-based technology. So a lot of focus has been on service delivery. But in my opinion, where we will see the biggest change, it will be the health finance sector. In the health finance sector, uh, biggest problem in these low middle income countries is the access to healthcare. I'll give you an example. In a lot of these countries like India and Pakistan, the health system, 70% of the people, they go to private sector. 60% go to private sector, 50% go to private sector. Now, when they're reaching out to the private sector, they require something called as out of pocket payment. Out of pocket payment is that they go and they ask for a service and then they pay for it. Problem is with out of pocket payment, if someone is rich, they can easily pay out of pocket. But what if someone is not? And we know this; these are low middle income countries, so a lot of people are not rich. Hence, in these countries, what we see is that people end up with something called as catastrophic cost. Catastrophic cost is that when a big chunk, say 40% of your savings, are ending up in your healthcare cost. And so you end up losing your house, you end up losing your vehicle, you end up losing a lot of stuff. And your savings are depleted. And so poverty is the end outcome of illness in these countries and because of catastrophic health costs.
Mm.
Now, what fintechs can do is that by providing these micro loans or by providing these micro insurance, and micro insurance have now become a part of big health system revolution. How, say, for example, someone requires medical care and a startup that is providing these micro insurance, it will only charge, say, 5 rupees a day, which easily anyone can pay in these countries. And they will give a cover of somewhere around 35,000 per month to the person. And if the person is using this micro insurance, they can very easily pay the premium and also get covered for up to 35,000. Just giving an example, this is I know that major procedures will not be covered by this. For major procedures, the government can create initiatives where they can provide these subsidiary support for these micro insurance companies so that they can cover those larger procedures, those more expensive procedures which might require surgical care or intervention in the tertiary care hospitals. But these micro loans, these micro insurance mechanisms have two things. Number one, they give access of this insurance mechanism to even those who do not have a bank account, because most of these just require a national identification number. That's one thing. And they have a lot of telemedicine link up with their insurance mechanism. Hence, telemedicine provides that access as well. So rural areas come into the fold of the health system. Also, what this is doing is that all of these, say, telemedicine platforms that get associated with these micro insurance and micro loan mechanisms, what that does is that opens up a new gateway for collecting data for far-flung areas. So electronic medical record of these telemedicines would have they would have primarily data for patients and communities that would never be accessible in the urban areas. That would also give diversity to the data. And eventually, with the passage of time, this telemedicine will then result in a growth of lab services, result in a growth of radiology services, result in a growth of eventually the movement of interventions from tertiary care setup going towards these rural far-flung areas. So just an idea. Yeah.
So that's right. Okay, so you have discussed all the few of the challenges like high out of pocket payments and all the challenges you have mentioned. From your perspective, what are other key barriers like cultural factor or the infrastructure factor that hinders the widespread adoption of the digital health intervention in low middle income countries especially? And are there any successful strategies or policy from the policy perspective? Are there any solutions or the strategies that can effectively address these challenges?
Yes. So I think that's a brilliant question. So you see, the thing is that when we look at low and middle income countries, I won't say that this is something that is a limitation of digital health, but rather it's something that is part of the process. I'll give you an example. most of the digital health interventions in any building block that you look at in these low middle income countries, you would see that a lot of them are in the pilot phase, or a lot of them are just getting out of the pilot phase into the demonstration phase or the scale up phase. Now, problem is that when these interventions are in pilot phase, a lot of them will fail to reach out to become scale ups. Now, a lot of the problem that we see with digitization of health system is that because scale up doesn't happen, we don't see the true potential of that digital technology. As time goes on, we will see that some of these pilots will become large scale up interventions, will become large scale up companies. Once that happens, you would then start to see the true potential of digitization. So I would say that the current issue is the small scale of the digital technology. Now, with that being said, there is another issue. Another issue is a lot of these initiatives are individualized. They are developed by individual startups or individual hospitals or individuals, maybe a renowned doctor, right? The inherent problem with this is there is no institutionalization. We need an institutionalization of these solutions so that we can have evidence-based practice applied. So research can be done on these things. Number one, there is no institutionalization in low income countries of the funding mechanism available for these startups. We need to have funding mechanisms which can come from venture capitalists, which can come from the government, which can come from funding agencies, developmental agencies, which can come from community itself through crowdfunding. So, but there is no institutionalization of funding. Now, that results in a problem because without access to funds, a lot of these startups cannot scale. They can do the pilot, but they cannot scale. But like I said, all of this is primarily because a lot of these low middle income countries are just venturing out into the digitization part. 10 years down the line, you will not see this problem. 10 years down the line, there would be funding available.
So, Dr. Hassan, you said that funding is a major issue. Like without funding, no startup can excel or they cannot reach their objective. But so, in your experience, how do the collaboration between all the government, NGOs, or the donors, or the other stakeholders and private sector can contribute to advancing the healthcare in digital health initiatives? How can they play their role? Because
Again,
because they are the bodies which can provide the huge amount, so it's we have to consider them also. So what in your experience, what role they play?
absolutely. I think this is again a great question. You see, the ROI, the return on investment, when it comes to healthcare, takes about 10 years. So if there is an investor who invests, say, around $1 million, or say they invest around $10 million into a healthcare intervention, the return that they will get 10 years down the line. No investor from the private sector would be willing to do that. Now, unless there is some element of social entrepreneurship. Now, social entrepreneurship is primarily funded by funding agencies who have a developmental agenda or the government itself of that country. Now, the government initiatives or the government funding of these initiatives is the key factor. And that only happens when the startup is linked with the government, when the startup is linked with academic institutions, and they form a conglomerate between academia, between the startup, between the government, which is the primarily stakeholder, the Ministry of Health in most of these countries. That kind of a conglomerate has the best chance of survival. But there is a missing link in this as well, which is the community itself. When there is a buy-in by the community, a lot of times, even in low middle income countries, the community funds the solution. And an example of that is we see clinics that were developed in low middle income countries in rural areas. A lot of the places where when the funding ended, the clinic ended. But in some places, it went on. Now, in the places where it went on, there were two reasons. Number one, the healthcare providers were coming from the community, so they didn't leave. The other was that there was a funding mechanism in which funds were being provided by the health, to the healthcare provider and to the funding to the health facility by the local population. by the local government. In case the local population cannot do this, the government can play a big role in this. So absolutely, I agree with you that we need to develop these conglomerates. And these, again, the development of these conglomerates can be institutionalized. Universal Digital Health itself is an initiative that basically focuses on just combining all of these, combining the government with the private, and also all of this with the academia. So all three together. So I hope that answers the question.
All right.
Thanks for watching. If you liked the video, please like the video and subscribe our channel for more digital health content. Thank you.